Ma'am, are you able to say it?
Yes, ma'am.
Yes, okay. Today my topic of authenticity and reliability. So first is the reliability. The reliability means like what we are supposed to consistent. Like if we are using a tool like thermometer or mat set, it is like mercury thermometer. It is supposed to measure the temperature. Every time we use the mercury thermometer, it should be like that. Means it should be consistently. It should measure the same thing. Then only it will be reliable. Then, according to Anastasi, the reliability of test refers to the consistency of scores given by the individual on different occasions or with different sets of equivalent items. The main thing in the reliability is constability, means the results should be consistent. Then we have types of reliability. We have two different types of reliability. One is external and one is internal. External means when like we just give a test at two different times. Then we check the reliability. Means externally we check the items. Externally we check the tool. But internal reliability is when we check within the items. If we are using a tool, then within a items we have to check it. Then it is internal reliability. Means if it is supposed to measure something. So in external reliability we have stability, and in internal reliability we have internal consistency and equivalence. Then external reliability means, as I have already told, means external reliability is it involves the extent to which independent researchers working in the same or similar context it would obtain consistent results with psychometric tests and questionnaires. It can be assessed using test retest method. Means there is one group. We are giving psychometric test or any type of questionnaire. After we just take the questionnaire, means give it to them. Then we assess the scoring. After a period of time like 1 week, means shorter the time period, highly it will be reliable. So like after 1 week, there will be the same participants will be there. We will assess the tool. Then it will come out with the external reliability, whether the tool is reliable. Means it is mirroring the same thing. It is consistent. If we are giving psychometric test, it is mirroring the same elements again and again. Like if we give it multiple times, it should assess the same thing. Like test retest reliability, it is to assess the external reliability of the tool. Means you have to administer the same test twice to the same exact group after a time interval has elapsed. Like there is a group, one group is there, there is a time gap. After that time period, like in pre-test, post-test, we give knowledge questionnaire to the same group. We assess the scoring. Then after some time like 1 week, 15 days, it depends on the tool. After a time period, we will again give this post-test. It should be reliable. We will calculate the reliability coefficient, that is R. If R value is between -0.1 to +0.75, it is considered moderate to good. Means the tool is reliable, but it is between moderate to good. But when it is more than 0.75 over zero point 0.8, you can say it is very good to excellent. Means it is highly reliable. The shorter the time period, highly it will be. Means like you are giving one test today. After 1 week, you are assessing the group. It will be highly reliable because the attainment of knowledge and skill will be more. Means they can attain more. If you are giving a teaching, they will retain it. After 1 week, it will be more reliable. If the time gap will be there, then it will there will be less reliability. So this is the R formula to calculate the reliability. And but we have to give the same instrument to the same group, but with a time interval. Then there is internal consistency. It measures the reliability of a test mainly based on the number of items. Like we have to is called item analysis. Like if a scale is mirroring a construct, then overall the items on that scale should be highly correlated with one another. Going to assess the self-esteem of the staff nurses. All the questions should be related to self-esteem only, other aspects. Means like if we are assessing the self-esteem, it should be focused on self-esteem, not the like behavior of the patients with anything else. It should be only related, the item, all the items should be related to the same concept. There the internal consistency. One is Cronbach's alpha and second one is item total correlations. Cronbach alpha, if 0.95, it is excellent. If it is 0.7 to 0.8, it is very good. If it is 0.6 to 0.7, it is set. And if it is less than 0.6, then it is suspect. Means there is some lacking in the tool. Like we are giving this subjects, then we are assessing it with the statistical inferences. Means we will be using statistical tests. With that, we will be reliable or not. Firstly, we will find out the external reliability, and secondly, we will find out the internal reliability to prevent the. Second is item total correlations, the correlation of the item with the remainder of the items. And for this 0.30 is the minimum acceptable item. Next is the equivalence reliability. It is also part of internal reliability. It refers to degree to different forms of an instrument obtain the same result. Means like two or more observers using a single instrument. Like we can say inter-rater reliability. Means two different observers same to same group. For example, two teachers are reading same essay, scoring them consistently. Using same checklist to make the observations, it can be expressed as a coefficient. So it is also a part of reliability. It is means two observers will be using a single instrument and to obtain the same result. Then we it also proves that it is the two. So these were the two types of reliability, external and internal. For external means on the same group with the time lapse. Then again we will assess it, and it is the test retest reliability. The tool used is test retest reliability. And second thing is internal reliability. Internal means within the items. Items are related or not for Cronbach's alpha, and then we have inter-rater reliability. So this is the reliability. Sources that can cause unreliability. First is test scoring. Difference between two scores judgments. Like if we use one observer is using some different, like when one is using different criterion measure and a different criterion measure, it can affect the reliability. Then the tool will not be reliable. One score over time or halo effect. Sample of test items is too small. Means we have taken only 10 sample, 20 sample, 30 sample, then we cannot general. Then means it is not according to the material. Then third is test administration. There are external extraneous like noise, time limits not consistent, physical conditions. Then there are personal conditions like temporary ups and downs. When we were giving tests, the subject was anxious about that, or there were some he was busy, he or she did. So there will be they will not fill tool accordingly, and there will be unreliability. So means like factors when we control the extraneous variables, like we have to prepare our test according to that. The test items should not be small, it should be, then we have to correlate the items. Like for one means like if we are going to assess anxiety, then it should the whole related to the anxiety only. So this was the reliability. Then next is the validity. Like in reliability, the tool what is supposed to measure, it is measuring consistently. But in validity, what it is supposed to measure, like it should be appropriate, meaningful, and useful. It is the definition according to standard for educational and psychological testing. Then we have different types of validity: face validity, content validity, criterion validity, there are two things. Like for reliability, we have to give the tool and to the subjects. But for the validity, we give it. They will give us the validity. Like face validity. Face validity is your how does it look? Whether it looks good to me or it looks okay, looks to measure what it is supposed to measure. Like if I am using the psychometric tool, it should measure the psychological aspects only. Like of the thing I can judge means like whether it is valid or not. And it is done by the various experts related to those special things. Then look at the items for appropriateness, whether it is going to assess the clients. Like if it is for the staff nurses, there should be mentioned, means to the dealing with the patients and dealing by the staff within themselves. Then if it is for the students, it should be according to that. If students, it will be different. If it anxiety tool is for staff nurses, it will be different. Then least scientific validity. Validity, it will tell only that it is like the subjective type, means I am looking at the tool and I will, from the look, I'll judge whether it is. Does the test contain items from the desired content domain? Means means while we are using Likert scales, while or we are assessing the quality of life, we will be giving different domains: logical, then spiritual. So it will means like from content we will see whether it is assessing all the domains or not. Assessment by experts in that content domain. Like if it is for the, like it is psychometric assessment, then the expert should be from the psychiatric background. If it is cancer related, then they should be from the onco department. And the doctors can also be the experts and relate, like psychologists and everyone. Means like it should be related to those domains only. Then is especially important when a test is validity. Means like if it is like if the face validity is low, then it is the more key, like we have to make the content like. But from the face validity we cannot judge whether it is valid or not, but with the content validity we will be judging it. Like for example, it is easier for math experts to agree on an item for an algebra test than it's for psych expert. Means like a math only the math tool, and psychiatry expert, like if it is for emotional intelligence or we are judging the personality measures, we are doing for the academic performance, that then that tool is validated by psychology experts, psychiatry experts only. So content validity for whether it is assured by experts only. Then we have criterion value, like it is the extent to which people's scores are correlated with other variables. Like we are going to assess the emotional intelligence using that tool, EI tool, then it should be correlated positively with the academic performance. Like there is a statement going to assess impact of emotional intelligence on academic performance of the school students. Means like we are going to assess the academic emotional intelligence. We have to correlate them. So it should correlate positively. This is the criteria of that tool. If it is fulfilling that criteria, that means it is valid and it is also done by the expert. Then second example is like aptitude test. It should means correlate with work performance. So the tool should be like that. From face, it should be clear, like it is is mirroring. Then content should be mirroring the same thing, and it should be validated by the concerned expert. Then in criteria, there is a criteria to correlate, means whether they are means it is assessing two variables or not. Then how it is constructed, means firstly it is internal structure, whether it is based on single, means if we are going to assess the self, then internally it should be constructed with the valid items. Then what will be its use, like there will be positive items, there will be to give the scoring like that. Then what is the content, whether it is mirroring the same thing or not. Then response processes, whether the age group will be able to respond it or not. Means like if we are using it for primary means like from senior secondary will be different questionnaire. If we are using it for the smaller ones, then it will be different. If we are using the tool for the elderly, it will be different. It will be according to that. So the should be according to that. Then association with other variables, we have to correlate the variables. If there are knowledge and attitude, we are going to assess knowledge and attitude. The tool should be according to that. One tool is for knowledge, one tool is for attitude. But at the end, we can correlate the tools. We can correlate the variables. So the construction should be accordingly. Threats to the validity, like confounding, means like there will be the threats to the validity, like when effects of two variables cannot be separated, means there are two variables but we cannot separate it, so it will be causing the biasness. Second is selection bias. While selecting, we are going conveniently, we are not randomizing, like if we are going for the in the hospital, we are going for the same hospital, we are taking the control group as well as the experimental group. This will be selection bias. If there is a means like if we are only one hospital, then you can means for firstly you can take control group, you give them tool, you just give your internship, and then you assess the tool. And in the second part, you will be selecting your control group. You will be selecting your experiment, and then at the same time you cannot assess the both the groups, because then there will be biasness. History means like events from affecting your tool validity. Then maturation means like time gap is more, and for 1 year you are assessing the thing, for 1 year you are using that variable, you are for 1 year using that tool, then that will also affect the validity of the tool, because the tool will not be valid. Because if you are engaged, the level will be more. Then repeated testing, you are using same test repeatedly for the first, means like if there is knowledge questionnaire, you are giving it first time, the result will be different. After giving your intervention, the result will be different. But if you repeat repeatedly, then because they will be aware of the questionnaire, and there will be biasness. Then instrument change, all of a sudden due to some condition you are changing the tool. If you are going to change even one item, you have to again follow the same procedure to assess the reliability again. If you are going to change even a single item, so you cannot change the instruments. Then mortality means like unfortunately there is death of the subject or something like that, so that will also a threat to the validity. Then experiment bias, as I have already explained, for the experimental and control group there is experiment biasness. Like for one group you do you have to use there will be accuracy, like for one group you are giving the intervention, for the second group you are not giving the intervention, so there will be biasness. You can avoid all external validity or internal validity factors. So this was the validity and reliability. Then validity versus reliability. Validity means the test with what it is supposed to measure, it is claimed, it then in reliability there is consistency, as I have already explained, means once you are giving the test second time, third time you are giving the test, there will be consistency. It will be measuring the same thing. Then measures whether the extent to which the test claims to measure is achieved. Be just looking at whether the objectives will be achieved or not. And in the reliability, whether the consistent results are coming or not. Types of validity, internal and external, same way reliability. Means at the end, I can explain in one line, like reliable results are consistent. There will be consistency of the results. In validity, we have to satisfy the objectives. Tool will be according objectives. We have to fulfill the objectives. So experts will be uh, validating your tool according to the objectives. And reliability, that is statistician, you can also check the reliability, but you can cross check by getting it done from the statistician, because you have to do the test. Cronbach's alpha has to be calculated, coefficient correlation has to be calculated. So in the reliability, results are consistent and it is done by the tools. In validity, we have to satisfy the objectives and it is done by the related experts. So all about my